Now we'll start photo shooting session. The roundtable discussion participants.
それではまずは正面のスチールカメラの皆様に目線をお願いいたします。皆様では
Please smile a little bit.
スチールの皆様よろしいでしょうか。はい、ありがとう。
Thank you very much. That was a still photo. And then for the videos.
Back. ムービーの皆様よろしいでしょうか。大丈夫そうでしょうかね。はい、
Thank you very much. So thank you for the roundtable discussion participants. Thank you for joining us despite busy schedule. So next, three of the executives, Eric-san, Ryan-san, and Mr. Sam.
Ah, 少しパネルを動かしていただきたいということです。
So a little bit of position adjustment is going. Okayama-san すごい張り切って撮ってるけど。
スチールの皆様よろしいでしょうか。それではお二方握手をしていただき。
So Ryan-san, Mr. Sang, could you shake your hands?
では、スチールの皆様よろしいでしょうか。では、奥のムービーカメラの皆様。
That was a still image. And then for video, please.
ムービーの皆様よろしいでしょうか。はい、ありがとうございます。ありがとうございます。
Thank you very much. That's all for photo shooting. Thank you. Thank you very much for your patience. We'd like to first take questions from audience. We have Mr. Son and we have Mr. Eric Rafkovsky and Mr. Ryan Fukushima will address your questions. Please make sure to state your name and which media, and your question should be addressing to those three gentlemen and limited to this today's topic only. The first question. Ito from Business Insight Japan. Thank you very much for taking my questions. Two questions. First, Mr. Son, with this partnership, so genomic testing is, sorry, we'll try to. So I have a second question to Tempus. Japanese market, I hear that a lot of medical information is available, but what's your expectation and opportunities that you can hear or you can see in the Japanese market? That was my second question. First, insurance coverage. Talking about insurance coverage, which should be covered, what should not be covered, we should discuss more. Genetic testing should be covered or not, we'll discuss more. The second question to Ryan or Rick. Ryan or Eric. So what was your second question again? What was your second question again? You're talking about Japanese market, right? Yes. To either Eric or to Ryan. What's your expectation? Thanks to the national medical healthcare insurance coverage, we hear that there was a lot of medical information available. So what's the value of the data set available in Japan from your perspective, either Eric or Ryan, please?
I can start. Well, I think our expectation is similar to what Masa was talking about and what we were talking about, is that we really believe that the Japanese market is poised to start collecting not just the clinical information on patients, but also the genomic information, so that we can deliver, the most actionable information to physicians to tailor these treatments to each patient so that they can benefit and live longer and healthier lives. And in some cases, those treatment options are actually clinical trials that can really benefit, that patients can benefit from. And if still there's not an actionable treatment option and there's no clinical trial that's relevant, that's a severe unmet need in everyday care. We want to use the data in those situations to really advance drug development to address those unmet needs. And so that's why the business of our performing genomic testing and collecting the data is so essential to go together, so that we can not just help tailor the treatments of today that are already approved, but really advance, the drug development and accelerate that R&D with biopharmaceutical companies, so that we can do something about that unmet need and we can bring better treatments to those patients. And so our expectation is that the data is going to be really useful, because there are different unmet needs in different countries. And so we really want to bring this technology to the Japanese market in partnership with SoftBank, and that's why we believe that they're the ideal partner to help us accelerate and operate at a different scale than us at alone.
司会の方一人一問にして。
So limit one question to one person so that we can take as many questions as possible. Thank you.
So next person, please. And then the other.
The French newspaper Les Echos. Mr. Son, in the past, when you were interested in bringing in Japan a breakthrough technology, we were used to see you buying the company that had this technology or massively investing in this company. Why did you choose the joint venture format this year? Or did you try to buy Tempus and they say no, and so you went for the joint venture?
We did not buy Tempus. Tempus already was preparing IPO. So SoftBank invested $200 million before the IPO. Okay? And because Tempus did not need the money because already preparing IPO. So, but we want the Tempus to be super success. And we decided to do a joint venture here in Japan, 50-50. We are very excited about this opportunity.
And next question, please. Nagoshi from NHK, thank you very much. Mr. Son, press conference like this, I think it's been a while since you did last time. What joint venture with Symbolic was one of the example of joint venture you established. But you are present at the press conference for the first time for a long time. Is that showing your passion? We have been talking about AGI and ASI. Saving as many people as possible, as many lives as possible, as early as possible is one of the biggest missions that we'd like to fulfill, or ASI's mission to fulfill. I think the medical field is a very important application for ASI, AGI. That's commitment, that's a passion that I have, so that I want to be present at the conference like this.
We will take 3 more people for questions. MJ from Bloomberg. Currently, SoftBank LTV ratio is very low and also cash-rich company. So I believe that you've been sending the message you should be doing more new investment activities. And this time in Tempus project, are you going to invest more in such a similar type of businesses? What is your investment plan in the future? Our investment is to realize ASI. That's the main focus, and we would like to focus in the meantime. We have Arm as a core company of our group, and relating to that businesses, we would like to realize ASI. That will be our main focus in the meantime.
And next question, a gentleman from there. Sugimoto from Nippon Keizai newspaper. Nice to meet you again. Mr. Son, information revolution and medical field, by utilizing them to bring benefits to the humankind. When did you start thinking about that? I remember your speech 14 years ago. And I think you mentioned a similar thing at the beginning of a speech in 14 years back. So I wonder, when did you start thinking about that? And you refer a lot of time to your dad. And it was the first time for me to see you crying so hard. Yes, 14 years ago when we built a new 30-year vision, information revolution, happiness for everyone. Of course, that was the philosophy that I always had since the beginning. And then what can be utilized and how was the question I have had for a long time. And now AI and technology can be really helpful in the medical field. I am a strong believer, and the partnership with Tempus is, I think, the fruit of the passion that I have been carrying with me. And talking about my dad, I lost him to cancer, and when he was diagnosed, it was stage 4. Still really disappointing and still sad. My sadness is bigger and bigger. And again, I want to save as many patients as possible, and that is strong commitment and passion that I have.
So with this person, this will be the last person due to the interest of time for the question from the floor. My name is Miyajima from the magazine called Facta. And I think this was a great opportunity, great press conference. And I am also the same age as you, Mr. Son. So getting older, the first thing you think about is the genomic test. That's something that you would like to take. And because I think that it's a great thing that you mentioned that this is not available in Japan. Too many people, and I believe that the people needs to pay more attention about that because of the regulatory issues that the U.S. is available, but they may be difficult in Japan. And for those challenges, how do you think about? And now, like ministers of finance or ministers of health, labor and welfare, that you may be speaking to them or not, I don't know. But I think that there are things that you would like to do for the humans' future. And how do you like to address that? It's not a resistance, but we are doing for people. We are doing for the world. And hopefully that we all be able to join the proactive and constructive discussion. Things were not available is now available all of the sudden, and those 7.7 million US data will be available immediately in Japan, not only using US data, but in addition, Japanese cancer patient data will be also available, and we need to save those patients. And I think nobody can disagree with that passion, I think. And the methodology-wise, there may be several procedures that we need to follow, but I believe the goodwill from all those concerned parties. And with this opportunity, hopefully we'll be able to have a constructive discussion, positive discussion to make the things better. Thank you.
Thank you very much. That concludes question and answer session. Thank you, Mr. Ryan and Mr. Eric and Mr. Son. Thank you very much. That's all for press conference hosted by SoftBank Group Corp. Thank you very much once again for joining us and watching the live streaming. Thank you.